Achilles tendon pain can be a bear to overcome, and runners struggle getting out of pain and back into running the best they possibly can. I get it. But there is a solution you may have not considered. It's called Shockwave therapy. It's been a game changer in my clinic for runners, and I want to introduce it to you in this video. I'm going to tell you all about what Shockwave is and how it can be the one thing you're missing to get you back to running your best. Hey everyone, I'm Dr. Kevin Vandy, physical therapist and running specialist with Competitive Edge Physical Therapy. My team and I are on a mission to reduce running injuries worldwide. 80% of runners get injured every year, and that number needs to drop. So we'll be putting out educational videos every week to help runners reduce pain, improve performance, and get back to doing what they love as much as possible for as long as possible. So Achilles tendon pain. If you have pain down by your heel, along the back side of your calf, if your calf feels weak, if you have pain first thing when you get up in the morning or pain during or after your runs, it's likely you're dealing with Achilles tendinopathy. You can check out this other video here of a video I showed all about what Achilles tendinopathy is and what it isn't. It's not an inflammatory problem. Check out this video to learn all about Achilles issues. But in this video, I'm talking about a game-changing therapy you can use to get out of pain fast. It's called Shockwave therapy. Now, for those of you who have tried physical therapy, you've tried rest, stretching, ice, massage, dry needling, you've tried all those modalities and you still have pain, Shockwave therapy is an intervention you strongly want to consider. One of the reasons is Shockwave therapy for runners with Achilles pain has been shown to decrease pain and improve function in the short term and over a 5-year period, and even when compared to a treatment that looked like and sounded like Shockwave but actually wasn't Shockwave. So it works. The meta-analyses of studies show that Shockwave is an effective treatment for dealing with Achilles tendon problems. So the research is there. But you probably want to know what it is, and you want to know how it's going to help you. So what is Shockwave therapy? Shockwave, despite its name, it's not electricity. We're not shocking you like old school medical treatments. Shockwave is sound waves. So a high pulse sound wave creates a shock at a certain frequency, and that shock goes into a tissue like your Achilles tendon, and it stimulates recovery. Specifically, the benefits of Shockwave are it creates small micro traumas to restore the inflammatory cycle. Now, you may say, well, I don't want that. I don't want inflammation. Well, for those of you who have chronic Achilles problems, something more than 2 to 3 weeks, maybe even months, what's happened is your body's kind of forgotten about the tendon. You need to wake it up again. So the micro trauma, the stimulation caused by Shockwave, reminds your body that you should start to heal it. It creates an inflammatory cycle to draw new blood into the area to help with the healing process. So in this case, the micro trauma and microinflammation is a good thing because it helps with recovery. Because it's bringing in blood flow, it also brings in regenerative factors within your blood that are going to heal the actual tissue. So unlike ice or electrical stimulation, modalities that focus on treating the symptoms, helping you reduce pain, Shockwave therapy actually changes the tissue quality itself. So you're getting lasting relief from something that frankly only takes 10 to 12 minutes to perform a full treatment. Awesome, right? You get a better quality tissue, better recovery, faster recovery in a short amount of time, and it's non-invasive. So it's not a needle, it's not an injection like a steroid, and it's not surgery. You don't want to go there. Most people with Achilles issues do not need surgery, and most people do not need injections. In fact, steroid injections such as cortisone weaken the Achilles and likely lead to additional injury. So hold off on the injection, but do consider Shockwave. Another way Shockwave therapy works is to stimulate local nerve endings. What that does is it creates a very fast pain reduction. By stimulating the local nerves, you feel an immediate pain relief, usually right after treatment that lasts multiple days, and the more treatments you have, the longer it lasts. Remember, studies of runners that have chronic Achilles pain that had Shockwave even have pain reduction up to 5 years post-treatment. So yeah, pretty awesome for a short amount of time. The final way Shockwave works is it regenerates tissue. It helps to re-stimulate connective tissue that makes up your Achilles tendon. All the cells that help create a good, strong, healthy tendon get stimulated to go back to work and rebuild the tendon in a strong way so it can tolerate the forces of running. So Lots of benefits from Shockwave from very little time, and it's non-invasive, which win-win-win. So what can you expect from Shockwave? When you go in to receive Shockwave, it might be from a podiatrist, physical therapist, chiropractor, local health practitioner. Shockwave is available, not widely available, but is available in centers around you. So take a look. We use it at Competitive Edge, so we have plenty of experience knowing how it's going to feel and what you can expect from treatment. So when you go in, you're going to meet with your practitioner, tell them about where your pain is, how long you've had it, and show them which side of the body it's on. From there, they'll use some gel that they'll put on your tendon, and then they will use the Shockwave device. Makes a loud noise, like a click, 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 click. That's okay, that's normal. Again, it's not shocking you, it's not electricity, it's just sound waves. And then over the course of 2 treatments within that session that take each somewhere between 5 and 6 minutes, they will administer the Shockwave. Now, in some cases, Shockwave can be painful. That's okay. That's actually a good thing, because it's telling you you're using an intensity high enough that it's going to stimulate a change. But you're in charge. You get to determine the pain. Sometimes people don't feel pain. But if you do, just be open with your practitioner about how much you can tolerate. Again, the more you can tolerate intensity, the better it is for your outcome. Sessions last anywhere between 12 to 15 minutes. So you can do it on your lunch break, before work, after work. It's a great time saver for recovery, something that you don't have to go for multiple appointments or wait in line. You can just go and get your 10 to 15 minutes of treatment and feel better that day. How many sessions do you need? Most research will show somewhere between 3 and 6 sessions of Shockwave can do the trick. And even from that little amount of time, most people experience a reduction in pain that lasts 5 years or beyond and see an improvement in function. It's best if you combine Shockwave with running specific physical therapy. Those 2 things combined, by doing the strength training that I mentioned in my other video, tell you all about it. By combining strength training and Shockwave, you get the best way to recover the fastest. Some things to consider with Shockwave. Another benefit is you don't have to stop activity. Maybe the first 24 hours after treatment, you don't want to do any super high intensity activities, but you can walk, hike, you can train at the gym. You don't have to rest. If you had injections and other medications, they most often will have you rest. You don't need to do that with Shockwave therapy. Additionally, you don't have to take medication. That is something most people don't want to do. They don't like that it's unnatural, where Shockwave is just sound. So there's little to no contraindications from the therapy itself. When you're getting Shockwave treatment, you want to avoid taking anti-inflammatory medication, because that will blunt the response you're getting from the Shockwave. You don't want to get a cortisone injection. Again, that decreases inflammation, which fights against what the Shockwave is trying to do, which is wake up and regenerate the tissue. And the other thing you want to consider avoiding is any high load activity right after Shockwave. So let's review. Shockwave therapy takes 10, maybe 15 minutes total to administer. You only need 3 to 6 sessions. It doesn't require any injections or surgery. It works really fast. It can reduce pain quickly and last 5 years or more, improves function, is best combined with physical therapy, and can be the one thing you're missing in your Achilles tendon rehab program that can jumpstart you back into running, give you some hope, see quick results, and give you some motivation that you're on the right track and you're going to get back to running, get back to doing the thing you love at the capacity you were before, and hopefully even better, because you've been doing strengthening for your calf and tendon in the first place. So I highly recommend Shockwave. Again, there's very little contraindications. All the research shows that it's a great additional tool to use in the early stages to combine with physical therapy. And if it gets you running faster, why not give it a shot? So be sure to check out your local practitioners that have it. Call the office. Again, you can schedule it in the morning, at lunchtime, whatever is most convenient for you, but it can be the one thing you're missing to get you back to running the fastest. Hey guys, if you like this video, drop a comment below, let me know. If you've tried Shockwave and you've gotten relief, just give some thumbs up, give some positive energy out to those that are looking to try it, so you can let them know that it's worth doing and give them the push to go and get it done. Hey guys, please like, subscribe, hit the notification bell. Thank you so much for watching, and until next time, train smarter and perform better.